Hi, and welcome to Habits for Humans, the podcast that explores what makes people tick and how to program this brain of ours to do what we want it to do. We are going to explore why we can sometimes and in some areas of our lives achieve extraordinary accomplishments. And at other times, we are addicted to Cheetos and watching TV. If we want to be healthy and happy, what is the secret to programming our brain to maximize our potential? I'm your host, Kim Flynn, and today we're going to talk to the lovely Dr. Mel. And she's going to talk about the most important habit to live cancer-free. We're going to talk about knowing your risk with cancer and something that she calls precision prevention that I'm super interested in. So welcome, Dr. Mel.
Thank you.
We're excited to talk to you in just a second, but we have a couple of announcements for our listeners. We've got a couple of giveaways for our listeners at the end. We've got giveaways from our sponsor, Card Salad. We also have giveaways from Dr. Mel, so you'll want to stay tuned until the end. A word from our sponsor, I cannot talk today. A word from our sponsor, Habits for Humans, is brought to you by Card Salad, a health and wellness company that teaches you how to program your brain using systems and habits. So you know how everyone wants to eat healthy, but you haven't meal planned. And so what ends up happening is you go to the freezer and you pull out the pizza and the, chicken nuggets, and you call that good for dinner another night for your family. So instead of that, which I'm not blaming you or shaming you for that, but instead of that, let's have meal planning done for you. What I did is create a product called Eat Well. It's a done for you meal planning system. It comes with a menu board. You hang on your fridge, your recipes go on the board. Your kids always know what's for dinner. You always have meal planning done, and you always have the food that you need in your refrigerator through habits. So stay tuned to the end of this podcast, and we'll give you a free week of meal planning delivered to your email inbox. So I'm so excited to introduce to you Dr. Mel Palomares with multidisciplinary training and experience in oncology, epidemiology, and genetics. Dr. Mel, affectionately known as Dr. Mel, that's just what I'm calling you, practices preventative oncology. I love that, preventative oncology. Her focus is cancer prevention, early detection, and risk assessment. After 20 plus years in academic medicine, first at the Fred Hutch in Seattle and then at the City of Hope in the Los Angeles metro area, Dr. Mel founded Cancer Prevention Movement, which brings people together to work towards a cancer-free world. This one has special impact for me, Dr. Mel. My mom has colon cancer and is fighting that right now. And it's just such a brutal disease that just keeps coming. And so anything that we can do to do cancer prevention is so important to me. And I'm so thankful that you're spending your life's energy truly working on this. So we always start with your number one habit to manage your own mental wellness. And you talked about your morning grounding practice. Will you talk to us about that, Dr. Mel?
Oh, yes. It's so, you were talking about habits, and we're kind of, our society today is really habitually reach for your phone and start checking your email or notifications or what have you. And I find it really important to have some quiet time every morning to just go deep within, reflect upon the day before, think about what I'm grateful for. That really, it's sort of transformational. It changes your perspective on everything that happened and what's moving forward. So by thinking that about the day before, what lessons I learned, what am I grateful for, then I can set my intentions for the day moving forward. And so that's very healing, calming. It's great for me.
Do you have like a specific, I write things down, or I think of 3 things, or what's the exact process that you do?
Yeah. Do I have a process? I just have that quiet time, and I really listen to what I'm telling myself. I specifically don't write it down anymore, but that is a very powerful practice. The act of writing kind of brings attention to that thought in your brain. I don't remember the statistics, but there's like 40,000 thoughts that go through your head at any given moment, but there's only a few that your brain focuses on. And so when you write something down, it forces you to focus. I do that a lot with goals. But for like the gratitude thing, gratitude lists are really powerful. I haven't really personally, I'm just being honest, I haven't done it. I just reflect. I have in the past, but not as a habitual morning practice.
I love permission to not have a process. Permission, what you're telling us is, I don't need to wake up at 5 a.m. and do like an hour of this and 20 minutes of this and write down 12 things. It doesn't need to be that structured. It can simply be, I'm going to wake up, I'm going to have my coffee, and I'm not going to plug in during coffee time or whatever it is for you. I'm just going to reflect and be with myself. Permission to do that. I like that.
Yeah, actually, the more complicated we make it for ourselves, the less likely we'll do it long term. That's what I
Mm,
find.
I
So
agree.
there's an author, Sean Acor, that talks about having a gratitude practice, and he recommends that you do that every day at the same time, associated with something you always do. So if you're on a commute and you're at a certain red light, it like reminds you, I get to be grateful right now, and think about something that's happened in the last 24 hours. That's also another important thing. He says that we tend to say the same things we're grateful for, our children, our pets, our parents, whatever. And he says it's really important for your brain to think about what has happened newer, because in that process of scanning over your recent 24 hours, which is what I was saying I do, um, it just puts a different form of attention to that feeling of gratitude. You re-experience it.
That makes sense. That makes sense. I love that. All right, so let's get into our topic today. And I mostly want to hear you. I want to just listen to you. Will you talk to us about cancer prevention? Will you talk to us about categories of risk? Just launch straight in if you wouldn't mind.
Sure. So the question I posed was, what was the most for our topic today was, what is the most important habit for preventing cancer? And so if you just asked it without telling someone, I wonder, maybe your audience can think about, what have I said, and I've been in groups where it could be, something that they ate, or the fitness regimen, or something like that. Most people don't think that the really most important thing is to know your risk. And so, why might that be? Well, it's because the way you would go about screening and prevention is very different depending on your risk. So, in the medical world, um, this takes the form usually of someone unfortunately having cancer, and then they go see a physician, an oncologist like me, and then the oncologist reviews their family history, usually rather than behaviors, which also doesn't make sense. But they look at
Interesting.
the family history, and if there was a family history, there might have been clues. Um, and because that's a commonly associated with high risk, it doesn't mean that without that you don't have high risk. It also doesn't mean that with family history you're definitely at high risk. You could be at moderate risk. So knowing that difference is a nuance, I should say. And so anyway, what can happen at that point is that they get that clue, and they have genetic testing to see if they have a hereditary syndrome, which is part of one of the categories of high risk, probably a commonly understood one, I should say. And then that test ends up being a predictor for other people in their family. So it helps other people's be cancer free, but for that person who's the first person with cancer, they get to battle their cancer. And if they survive, then they go into and most people do nowadays, thank God, they go into a prevention mode at that point. In fact, even if someone who had cancer, once you have cancer, you don't go back to average risk, but it's moderate, not necessarily high. Most people then become very conscious about their health. My whole message is, why would you wait till you're sick to become conscious of your health? Really ties into what you do, or what your sponsor does, I guess. That we don't often think about investing in our health while we have our health, but it's super important. I talk all the time with financial planners because the principle is the same. You don't, I mean, some of us do, unfortunately, wait until you're in debt to take care of your finances. But the really effective folks, they don't wait to that point, right? They start planning. And the earlier you plan, the more time horizon, right? You have to build wealth. It is the same thing in health. You want to start with good, healthy habits and build that over time, because you're taking care of all your internal mechanisms that fight things. So fight infections, fight inflammation, fight cancer. All of those things help. But then, so back to the risk, what I want to get away from is it taking someone having cancer before they start paying attention to staying cancer free. So
So let's talk about that. So if my number one, so if I'm a 46-year-old female, which I now am as of yesterday, happy birthday to me. But if I am a 46-year-old female, my mom has cancer, my grandma on the other side had cancer, my grandpa on the other side had cancer, that kind of thing. So I'm looking at my risk as my number one habit, right? And do I get genetic testing, or how do I determine that risk?
Okay, so thanks for the question. When I said that family history is one of the, I should say genetics is one of the categories of high risk, it isn't the only one. And someone can have a genetic risk without having a family history, and someone can have a family history without having genetic risk. So, so the important thing is to come to someone who has a genetics background like I do. There are others, so I'm happy to refer if somebody wanted to know how to find someone near them. But it's teasing out whether your family history is significant or not. And so it's types of cancers, the pattern of relationship to each other and to you, the age at which they were diagnosed. All of that can suggest part of a hereditary syndrome. That being said, only 5 to 10% of cancers are part of a hereditary cancer syndrome. So this is a recognized high risk, but it doesn't account for the majority of cancers.
So interesting. So you recommend that if we're concerned about it, which I think all of us are concerned about cancer as we age, right? We should seek out someone like you that does genetic testing for cancer. Is that what you're saying?
For risk of cancer.
For risk of cancer. Sorry. Yes, that's an important distinction. For risk of cancer. And then you run a genetic panel, and then your office would say you run a risk of this type of cancer and this type of cancer. Is that how it works?
Exactly. So in that example, I was talking about someone had cancer. They're only thinking about that cancer, but it's on the physician to do this looking at their history. And it's usually, like I said, their medical and their family history. And which I think is unfortunate, and I want to get to that. But at that point, they might, if they qualify, they might have some genetic testing, and that if they find anything, okay, so lots of ifs. That's always saying it's a minority, but if they find something, they may have a risk for more than the cancer they have. And so they benefited from that information, because now they're going to have screening for something, or high risk screening for something that may not have been on their radar at all.
Okay. So just to get this right, can I go to a doctor like you and get genetic screening for the risk of cancer, or do doctors generally wait until after you have cancer to do that screening?
Well, that is a perfect question. So in practice, the reason why I brought up that example is because that is what is being done in practice, but it is not what I believe should be done. I think we need to get ahead of it and be conscious of. So if you have a family history, that's an idea, and you should call us. Because again, if I can't serve you, I'll make sure to refer. But if you don't have a family history, I think you should call us. So on our website, we have like some examples, but there are other things. So I haven't gotten to the other categories of risk yet, but that's
well, let's dive in then. Let's dive in. And just
in.
for our listeners right now, all of Dr. Mel's show note or links will be in show notes. So just check the show notes for all of her links. Let's dive into the other things that you wanted to discuss.
Right. So cancer in itself is complex. But to me, complexity is interesting. And my goal is to simplify it so that people, the masses can understand. So what I've done is taken the so many risks of cancer and put them into 5 main categories. And so the highest level of risk is actually the most rare, and the things that have the lowest risk but still can point to cancer are the most common. Okay.
Perfect.
So if I went to the most common first, because that's going to affect the most listeners, right? That would be demographic. And so clearly, men are more at risk of some cancers, women are more at risk of other cancers. Some people are transgendered, and the hormonal exposure could be associated with certain cancers. Doesn't mean you should change anything, but there's preventive things that maybe you should consider, or screening things that one should consider. Also, some ethnic groups. Ashkenazi Jews tend to have more of these genetic things run in their family. And so that's part of it. And then also certain racial groups, like unfortunately African Americans, for certain cancers, there's not necessarily a higher risk, but when or if they get cancer, they tend to have worse forms of it. So I would like to empower them to be more diligent in their prevention, because they can gain more by just avoiding a diagnosis. And then the very most common risk for cancer is age. And we all age. And so I like to point out here that chronologic age is not the same thing as functional age. And that's where having healthy habits can help your body stay young at a cellular level, even though our numeric age is getting older.
Got it. That makes sense. Okay, so that's the easiest thing to assess, and that's everyone's at risk there for age, obviously, as we age. And then if you do have hormone exposure, or if you're from African American ethnic group, you consult with your doctor and see what areas you're more, or what types of cancer you're more at risk for. Is that right?
Yeah, I would say, well, let me get back to that. Can I? Is that
Yeah,
okay?
please do. Yeah,
Let me
that's fine.
get through the categories, and then I can roll it all up together.
That sounds great.
So the next category is a huge one. It's called environmental, and that's not just what's floating in your environment, what you breathe, although that is part of it, but it's also what you eat, and your habits, like substance abuse. Tobacco is not just associated with lung cancer; it's associated with about 17 different cancers, and so. It's very addictive, and so even though a person should be, we can help them with tobacco cessation, the risk lingers for out to 15 years. So the proper screening is actually really important if someone has used tobacco, and not all tobacco is cigarette smoking. It could be smokeless tobacco. And so all of that is important. It actually historically has been the most common modifiable risk factor. The second most common is obesity or excess weight. And as behaviors are changing, I think that this is going to become number one pretty quickly, unfortunately. And of course, excess weight is also associated with risk of other common things like diabetes and heart disease. And so this is a great area that both of us are in. As a form of prevention of not just cancer, but multiple diseases. And then there are certain infections that are associated with cancer. Exercise, the lack of it, sedentary lifestyle is associated with an increased risk, and exercise can help decrease that risk. And there's a whole bunch of them that are from there, but I wanted to cover the most common. So that in itself can be a consultation. And I don't mean to cover when one-on-one with somebody. I like to say, well, this is what is relevant for you. But in this setting where we're talking about in general, sort of general education, I just want to cover the most common. And so then, yes.
That makes sense. A bunch of little quick fire questions. And if you can't answer them in quick fire format, totally understand. You mentioned hormones for trans people. What about hormones for women, menopausal women? Same influence there or not?
Yeah, thank you for that. So, yeah, it's certain hormones, clearly, but yes, postmenopausal hormone use is associated with certain cancers, such as breast cancer and uterine cancer.
Another
Um,
quick fire question. You mentioned obesity. What about the fit but fat? Someone who is eats well, exercises on a regular basis, lives an active lifestyle, but they are carrying more pounds. Are they still in the same risk category?
they are like I would say, we go by body mass index.
Sure.
So within
Mhm.
that category. So the more high the body mass index, the higher the risk, and sort of the moderate overweight, there's a higher risk, but not as high.
Okay. And then you talked about tobacco use quite a bit. What about marijuana? Is that linked to cancer as well or not?
I've gotten that question before. We need more study and history of being able to look at that. So we don't know yet.
Okay, good, safe answer. All right, keep going. So we've got number
Yeah,
5 is demographic.
I do want to say one thing though. When you were talking about obesity and hormone, it turns out those are linked. So our fat cells produce, they convert androgens, which are male-like hormones, into estrogens. And after menopause, that is sort of the biggest source of estrogens because the ovaries aren't making it anymore. And so that is one of the mechanisms through which being overweight contributes to cancer risk.
So that's interesting. So if you are fat but fit, which I think is a lot of the population, and there's especially in the anti-dieting and body positivity movement, there's a whole movement that I strongly support actually of loving your body as is and not
Hmm.
hating yourself even if you are overweight. But it sounds like there is medical reasons to say even if you're fat and fit, that the actual fat could be causing harm. Is that what I'm hearing?
Yes, I do want to clarify because I brought up body mass index that that's a very rough estimate because that's based on just weight. What's more important is the body fat. So certain scales have percentage body fat on there. That's more accurate than just looking at weight alone.
I appreciate the distinction there, and I know our listeners are like, "Wait, I'm I'm not on the BMI category that doing well, but I'm all muscle." So thank you for the distinction there. All right, so I want to get back to the 5 risk factors. We've got demographic, environmental. What's next after that?
Hmm. So, yeah, so the third one would be personal. So that would be like your medical history. There's certain things that are either precancers or risk factors for cancers. They're not so common. We're getting them less common. So there are certain benign breast diseases, not all of them, that are associated with breast cancer, certain benign prostate diseases that are associated with prostate cancer. Same thing with cervical. You think about abnormal pap smears. Well, it's just a form of precancer. There's certain lesions that can be found in the mouth when dentists do your exam that are associated with head and neck cancers, so on and so forth. And so there's certain medical history that is usually caught when I was saying that other example that I think is backwards after you have a disease that they find something that they tend to ask for, but for the average person they don't know. And so coming in for a outsmart cancer consultation relieves you of that. It is a snapshot in time, but there'll be a lot of education in that process so that you would know when to check in again.
Okay, so what I'm hearing is if you have abnormal issues, abnormal pap smears, abnormal benign breast developments, things like that, that you should understand that you might possibly be at higher risk for cancer and just stay really tuned into that with your doctor. Is that what I'm hearing?
Mm-hmm. Mm-hmm.
Perfect.
Exactly. There's something else called Barrett's esophagus. People that have a lot of reflux disease might
Oh,
have.
shoot, I have that. I totally have that, Melanie.
Oh, hmm.
Oh.
And diabetes, super
I don't
common
have that.
diabetes. And that has a higher risk of pancreatic cancer. And so there's, because so cancer, there's like over 100 different types of cancer. and there are different risk factors for the different types. So it's a lot of information that I walk around with in my head, but I want to share it with people because
Mhm.
I think that's important, because once you empower someone with knowledge, they spread it to other people. They tell other people. And so that
So
effect's powerful.
So I just found out, oh, I'm on the list. Yay, I'm on the list. So I'm on number 3. So I might have something that's as precancerous or whatever else. So what's my next step? Would I be more proactive about talking to my doctor about cancer prevention, or what's my next step?
That would be to go to our website and make an appointment. Yeah, because I unfortunately, I'm not sure how much general practitioners are. Some of them are very clued in, but not. And they're so busy; they're dealing with a lot of different diseases, not just cancer risk. And so, my whole goal is to at least educate people so they can continue. Because after the end of a consultation, there's a lot of information that's shared, and you can take that back to your physician locally.
Got it. Got
Mhm.
it. Interesting. Okay. All right. Number 2 and number 1.
Two is familial. So familial, you'll think that and number one is genetic. So you might ask, what's the difference? Well, families share environments and they share genes. And so what someone like me will do is go through the family history in a lot of detail and then determine whether or not genetic testing should be pursued. Um, and then that could be negative or it could be positive. So the positive isn't that very high risk, but rare. But if there's just a family history, there's still some risks, some moderate risks that we should be discussing, maybe high, depending on what the family history is. Um, there was something else I was going to say there.
While you're thinking of that, I can see why you stopped me from going down the, should we be all getting genetic testing? That's not what you're saying at all.
Yeah.
That's the highest risk person. So you kind of start at the bottom and work your way up, right? So we start with demographic and we look at ourselves and say, okay, I am getting older, so that therefore, risk of cancer there. Or if you're exposed to hormones or in different ethnic groups, and then you go to environmental. Am I taking care of myself? How is my diet and exercise? Then you go to personal. What is my personal medical history? And if any of those start to cause concern, then you'd go to the doctor or to Dr. Mel and say, hey, I want to stay on top of this. I want to prevent cancer instead of treating it after I have it.
Yeah. So I think you'd ask me a yes no question, and there's someone that I used to work with that used to say yo, because yes and no, and basically it depends. And so what you said is generally correct, but there are some ways that a person could skip forward to genetic testing. As I mentioned, not everybody has a family history. So one is having a history of cancer, especially if it was diagnosed at a young age. You don't have to have a family history. I think now people do recognize that, but maybe before, all the attention was put on treating the cancer, and it wasn't recognized and someone wasn't referred for genetic testing. So that would be one reason. And then another that I advocate is young women that are aged 25 to 40. The reason why is because they are not getting breast cancer screening, and that the average person is not getting breast cancer screening at that time. But if a mutation were to be found, high risk screening would start at that time. And I've just seen too many women that have breast cancer in their late 30s that just weren't caught, or in their 40s because they delayed getting their mammograms. In fact, we're concerned that that's going to be a big problem after COVID because people haven't been doing their screenings. So that is another group. And then I'd say men or women between 40 and 50, because most screening doesn't start until 45 or 50. And so it would make a difference for you if you were found to have a genetic finding. And there are now labs that offer this to people that don't fit all the things that most doctors are looking for.
Interesting, interesting. I love that. So earlier screening, and more, I don't want to say aggressive, but more maybe more liberal genetic screening is what you'd advocate then.
Absolutely. And I'm not the only one. There's a woman named Dr. Mary Claire King, who was the person who first described the BRCA genes. A lot of people know about those genes and risk of breast and ovarian cancer. She is a professor emeritus now at University of Washington, and that's where I trained. So that's why I've been doing this for 20 years, because I was where this was all being discovered, is where I trained.
That's the training ground to do that on. That's awesome. Let's talk about where people can go on your website to find, you have this No for quiz. Will you talk to us about that?
Yeah, we call it the No for No quiz. And the reason why we named it that is because I say all the time, the first step to have no cancer is to know your risk. And so one could go to our website, which is canpreventmovement.com, and then check on your risk, or there's a shortcut that's just no for the number 4, no.com. And it is a 10-question quiz, super quick, and it goes through these high-level categories. They're just triggers. So it's very easy, as you saw yourself, to just click one of them. But it shows, could you benefit from a consultation or not, basically.
Awesome. And I have it down. It's 2 different ways. Is it no, KNOW, the number 4, NO, or do I have it reversed?
No, that's right.
That's right. Okay, perfect. So no for no. And of course, that's in the show notes as well. And also in the show notes, guests can get a $50 off coupon on their service of choice with Dr. Mel's organization, an Outsmart Cancer consultation. And where are you located, Dr. Mel?
I'm located, or our office is in Arcadia, California, which is very close to Pasadena, where the Rose Bowl Parade is. But I do all my consultations via telehealth, or nearly all of them. Sometimes someone will come to the office, but especially during COVID, most people don't anymore. And so I just do telehealth, and I can do something that's more educational for out of state, and do a full medical evaluation if you're in California.
Awesome. So encourage you to check out the show notes on that. Again, it's canpreventmovement.com, and would encourage everyone to take that No for No quiz. I'm going to take it right now since we end here. I want to figure out my esophagus thing.
Yeah.
What's so interesting is when I was told that, they were like, oh yeah, you have this thing. It's not great. And that's all I know about it. And I'm like, okay.
Did they tell you how to be, see what I mean?
See, I know.
That's why I'm afraid to say go to your doctor only.
Yeah.
I really think a consultation is worthwhile so that you can be your own advocate with your doctor. I think that's really important. So your very first question is how to go about this. And so the way I do this is I first rule out all the high risk things. And then if not, then we can deal with, average or moderate risk. What are things you can do? And a lot of that are behavioral or lifestyle choices. And so my other set of services is related to health coaching.
Awesome. I love that. Kind of a one-stop shop for all things cancer prevention. I love that. Well, thank you, Dr. Mel, so much for joining us. Thanks to our listeners. This has been fascinating. And again, I want to encourage you to go take that quiz, that 10-question quiz, canpreventmovement.com. I know I'm going to take it right now. This is Habits for Humans, the podcast that teaches you how to program your brain to maximize your potential and live a cancer-free life. Thank you in advance for giving us a positive review. Thanks, everyone.